Hello, Dr. Perla here from Norwood Hospital, and reaching out to you today to provide an update of your local health system. As you can see, I am wearing a mask. It is our new policy here at the hospital. We'll get into that and talk about why we're wearing masks and what we're doing with others to wear a mask. But for today's purpose of doing this, I'm going to take my mask off, but I did want you to know you are going to see everybody wearing a mask here at the hospital. So for today, we are going to start and talk about our status here at the hospital. As you can imagine, like most other health systems, we are seeing the surge. So we are busy here at the hospital. We are prepared. We're going to talk about what we've been doing to prepare and talk about where and all the functions here at the hospital. So the first and most important thing is a lot of people hear a lot about critical care and ventilators. And what have we done here to prepare for that? So with a really amazing dynamic team of our nurses, our leadership, our physicians, and all our support staff, we have been able to almost double our critical care ICU capacity. So we normally take care of up to 10 patients in the ICU setting. We are now going to be able to take care of 18. And that, what we call as an alternate care location, is already open. And we are already seeing patients in that area, which means we are seeing a lot of critical care patients. What happens, or what do we do if we actually expand that? What if the need is greater? Again, through all of our work with our members of the team, our nurses, our medical staff, and everyone, we have been able to identify additional alternate sites of location, which include our endoscopy GI center and our sleep center. So both of these locations are prepared, normally take care of individuals who require some type of form of anesthesia or some type of critical care medicine. So it's actually relatively easy for us to convert those to additional medical surgical beds or even an additional critical care bed. So that would bring our capacity up even higher. We do not believe we're going to need that, but we're always going to be prepared for the worst. Next is overall our volume here at the hospital. So most people know our medical surgical units are all in the LaRusso building. So we label those as L2, L3, and then the ICU is in that building. Today, we have dedicated COVID-19 units on those floors. So L2 has a dedicated COVID unit. There's 3 units on L2, 3 units on L3. On L2, we have 1 unit. On L3, we have another unit. Why do we dedicate the units? Well, obviously we want a cohort. We want to keep people that are sick with COVID in a certain location, and we want to keep people that are sick not with COVID in another location. We accomplish many things by doing this, but most importantly, we're doing what we want to do is keep those patients separate from each other. So lots of questions regarding our testing facility and our testing tent. So our testing facility is open. It's relocated indoors now. So it was originally in the tent, and we quickly grew out of the tent. Our process was very impressive, and next thing you know, we had everyone from all neighboring towns coming to our facility, and we want to do our best to serve everyone. So we relocated the process to our surgical day area. That surgical day area is now serving up to 120 patients a day. We are open Monday through Friday from 8 a.m. to 6 p.m. We are open on weekends as well. We're currently open 10 to 2, but if the volume changes, we're going to flex with that, and we'll either increase or decrease as the needs of the community are met. How do we accomplish testing there? Well, now that COVID has been around for greater than 30 days, we're really asking everyone to work with their primary care physicians. So if you have a primary care physician, reach out to them. They all know our numbers. They will fax an order over. You're going to pre-register, and we're going to give you a time. The timing isn't a specific appointment. It'll say, our registrar will say, please arrive between 9 and 10, or please arrive between 2 and 3. That way we give you a window of opportunity to come in and get your test done. How long does the test take? It only takes a minute. So when you come in, you'll enter. If you're not wearing a mask, we'll give you a mask. And they'll confirm your registration information, and then someone will bring you over to our testing location. The actual collection is very simple. You actually you'll have your mask on like this. The nurse will ask you to pull your mask down. like that, and bend your head back, and then they will put a nasopharyngeal swab into your nasal cavity. They'll go pretty deep. You want to make sure you get pretty far back there. Dab it and then remove it, and then you're done. And then you can just exit right from that location. It's very simple. How long does it take to get my result? So it varies. We've seen results come back in as little as 24 hours and as long as 4 days. Now, I know that there's a lot of anxiety waiting for testing, but at this time you're supposed to be isolating. So you shouldn't be mixing with other people. As soon as the test results come back, our staff are calling immediately. So you don't need to call back in. We will give you a call as soon as they become available. New. So we talk a lot about testing in people that are concerned about COVID, but we really haven't been talking about the people that have COVID. So people that have been diagnosed with COVID, there is follow-up care that is necessary. So what we have done here is we have created an alternate site location for chest x-rays. So many times doctors are looking to see if your chest has cleared. So we've created a alternate site in our COVID area. So you'll come in that same location where you got your test, let them know you're here for an x-ray. Again, your doctor needs to order that x-ray. You'll pre-register, and we'll do a chest x-ray and get those results back to your doctor ASAP, typically within 4 to 6 hours. The hours for that is Monday through Friday from 1 to 4. If you need a different date or time for your chest x-ray, definitely give us a call and we can try and find out an alternate location or time. Staffing and illness. So there's a lot of news and media associated with healthcare staffing illnesses. So we are very fortunate here through our great work with employee health and our staff being well educated on the use of PPE. We actually have a very low amount. There's 2 cases. There's either someone is out ill and we ask them to stay home, or they may be on quarantine. So if someone's on quarantine, it could be that they were exposed by a family member at home, they could have been exposed at work. Regardless, they're going to be quarantined working with employee health. In overall, Norwood Hospital has over 1,000 FTEs. We only have 20 individuals that are out of work at this time. We're very fortunate. We're doing everything we can to keep that number as low as possible. And the good news is, of that 24 of them are already back to work. So we're in great shape with regards to operating here at Norwood Hospital. So I want to talk a little bit about community support. We talk about PPE and some other areas. But before we jump into community support, because it's just been so overwhelming, I do want to get through a few other items. PPE. So we get a lot of phone calls regarding donations. So the most important thing that we can have here is N95 masks. So where do I get an N95 mask? Why would I have an N95 mask? People who use N95 masks are very familiar. So if you're a sander or a painter, you might have even something called an N100 mask. So we can use those. A lot of people have been out of work, they can't go to work, and they may be a painter and have 5 N95 masks. And they think, well, that's really not much. Every little bit counts. So if you have those masks and you're willing to donate them, we would absolutely take them. They are really, for us, our primary defense against COVID for our staff. So we're happy to take those. Other donations, gloves, face shields, they're all great. Thank you. We're happy to take those as well. We want to talk about our visitor policy. So I know this is a very difficult time for a lot of people, especially individuals that have COVID-19 and are here in the hospital. We have changed our visitor policy to no visitors. We had to do this for a variety of reasons, but most importantly, we need to make sure that we're protecting our staff and the community itself. We found a few instances where individuals were coming in and just really didn't understand what you needed to do to keep yourself safe from the person you're visiting. And for us at this time, we really just can't have that type of distraction. We need to focus on our patients, and having individuals go in and out of the rooms, potentially exposing themselves, then bringing it back, exposing their family members and loved ones, it was just too big of a risk. So at this time, we're asking for no visitors. There are a few exceptions. So if you're having a baby here, which is very safe to do, we're actually very busy right now in maternity, a labor coach is absolutely welcomed. We're going to screen them as well because we want to make sure that our maternity floor stays very safe. Your labor coach can't have a temperature or be quarantined. And then as far as visiting the babies afterwards, unfortunately that's not allowed at this time. Most people do go home within 24 to 48 hours, so I know everyone wants to celebrate the birth of a new one, and we want you to celebrate too, but we need to make sure that everyone stays safe. With regards to other individuals looking for visitation, so on L2, L3, or the ICU, we're asking for you not to come in and visit. At this time, the only thing that we're allowing is an end-of-life care visit. I know these are very difficult times. People want to come in and visit, but we just can't do it. We really need to focus on the safety of everyone, including yourselves. So nursing homes, we want to talk about our local skilled nursing facilities, assisted living facilities. There's been quite a bit of media and news regarding them, especially here in Norwood and in some of the other areas. We want you to know what Norwood Hospital is doing to help those facilities. So we truly believe we are all part of one healthcare delivery system, and it's very COVID-19 is very new for everyone, especially nursing homes and assisted living facilities. So when there is belief that there is a concern for COVID at those facilities, our hospital is reaching out to them, and instead of putting them in an ambulance and exposing our EMS and first responders, our staff here, our nurses, are training nurses over there to perform a nasopharyngeal collection, or going over there and actually collecting them themselves. We want to do everything we can to keep the amount of transmission through the public systems at a minimal. So if we collect the specimens or we train their staff to collect the specimens, those individuals get to stay in their bed. And we've done this probably 50 or 60 times already. And I have to be honest, a lot of people are fine. They might be positive, but they're staying there and they're working through it as well. And then in the instance, if someone becomes sick at a higher level of care, they transfer them to Norwood Hospital and we do take care of them. So we want you to know we're partnering with all of the communities. And a big shout out to our nursing staff who has really just taken the brunt of all this training. Leaving our hospital and going to another facility to help others is really just an amazing task, and we thank them so much for doing that. With regards to other community support, I have to say I'm overwhelmed with the support. I have a small list. This isn't the total list, but I just want to give a shout out to a few of the people that continue to donate. And I understand there is something called the Friends of Norwood Center, and that is a fundraising procurement. So if you want to make a donation, it's going through this center, and then they are working on how to utilize local restaurants to help them as well, keeping them busy, and then feeding all of our staff here. And I have to say we're pretty much getting something every day now. Lunch, breakfast, dinners, the support is amazing. So just a few notes. Panera Bread in Walpole, Waters Church in Norwood, Subway of Norwood, Roxanne's Taqueria, Joseph Pruell, Esquire, all these people using local restaurants such as Chick-fil-A and Subway and let's see here, more Panera, other things, face shields. So a lot of companies aren't making the products that they normally make, so they've converted to create face shields for us. And there are so many uses for face shields here, so we are very happy to take those donations. Corbus Pharmaceuticals, Dan O'Brien Kia, Corrine Jackson Photography, Crisp of Walpole, Norwood Youth Football and Cheer, Ideal Glass, Darger Financial, The Sage School, WD Development, Verizon, Tyvek suits. So that is something that we're starting to see a replenishment of. So if you normally have a Tyvek suit and you're not using them, that is something we could use. And I know a lot of people that typically use Tyvek suits might be bigger males. So the triple X's aren't really working great for our nursing staff. So small, mediums, large would be great. Let's see here. The OCC of Norwood, multiple deliveries from them. And then Easter Sunday, we'll all be here on Easter. IHS Market and Murph's are donating food for our staff on Easter Sunday. So want to just, again, this is a small example. I'm sure I'll be back out here more, and we will provide some additional information. Lastly, I want to talk about successes. So I know there's usually a lot of negativity and talk about mortality, which is anxiety, causes anxiety, and it's disheartening. But I want people to know here at Norwood Hospital there are success stories. There are people that have been here on a vent for 10, 12, 14 days. They're coming off the vents, they're going to the med-surg units, and they're going home, and they're going to be fine. We've had 3 amazing success stories this week of people coming off vents. So we want you to know people are making it, things are working, and people can survive and go on and be healthy. So we are here, as a reminder, we are here 24 hours a day, 7 days a week for our community. And if there's any needs that you find that aren't being met, we're working with all our primary care physicians. We can connect you with a primary care physician. There's quite a few people that we have been coming up positive for COVID that don't have a PCP. The Steward Network is doing telehealth visits. You can see a doctor through a telehealth visit in less than 24 hours. So that is our weekly update. Thank you so much. Thank you for all the wonderful support, and we hope everyone has a great Passover and Easter Sunday. Thank you.